Okay, hello everyone. So this is another small video regarding the different triangles of neck and why we should be studying about these triangles. So on the view of surgical oncology, head and neck oncology occupies quite a big amount of patients, and these patients do present with different malignancy in the oral cavity as well as in the pharynx, in the neck, like including the organ like thyroids and parathyroids. So the oral cavity cancers usually has been found to be metastasizing into the regional lymph nodes which are present in the different triangles of the neck. So it is very important for us to clear the specific lymph nodes around in these triangles, and the level of these lymph nodes are also classified as the different triangles. Okay, so on this small video, so I'm going to say show you the different triangles of the neck. So basically, on one side, the neck is divided into two major areas. One is the anterior triangle, so this one is the anterior triangle, and this one is the posterior triangle. So this distinction is made with regard to the sternocleidomastoid muscle. So anterior to the sternocleidomastoid muscle and lateral to the midline, these constitute the anterior triangle, and posterior to the sternocleidomastoid muscle and midline would constitute the posterior triangle. And these two triangles are subdivided into further smaller triangles, like the submental triangle, which is between the midline and the digastric muscle. So the digastric muscle, which attaches to the hyoid bone, the anterior belly, and the midline would form the submental triangle. So this is the level or triangle 1. Okay, so on this area we'll have the 1A lymph node. Okay, and well, I will be covering about the lymph node stations later on. Let's just briefly describe the triangles. So with the midline in midline medially, and the anterior belly of digastric laterally, and the mandible superiorly. So this constitutes the submental triangle. And another is the submandibular triangle. So submandibular triangle is this one. So this goes and attaches the posterior belly of the digastric, goes and attaches to the mastoid process. Okay, so to the mastoid process, this constitutes the submandibular triangle. So this is it has got margins with anterior belly of digastric, and superiorly the mandible, and posteriorly the posterior belly of digastric. And this one would be the muscular triangle. So this muscle is the omohyoid muscle. This is sternocleidomastoid, and this is the posterior belly of digastric, and this is the anterior belly of digastric. So, and this is the hyoid bone. This here the green dotted line. This is the midline, and this is the sternum, the membrane sternum, and this is the clavicle. So the anterior triangle is subdivided into so this one is the cervical triangle, and this one is the muscular triangle. Cervical triangle lies laterally to the anterior belly or to the superior belly of the digastric muscle, which bounds in anteriorly. Superiorly, there is the posterior belly of digastric. Sorry, I said digastric. This is the omohyoid muscle, anterior or superior belly of the omohyoid muscle, and superiorly the posterior belly of the digastric, and posteriorly the anterior border of the sternocleidomastoid muscle. So this forms the cervical triangle. So this forms the cervical triangle. So this forms the cervical triangle. Okay. So let's see. This is the cervical triangle, and with midline in the medial border, and superior border of the omohyoid, and inferior posteriorly the sternocleidomastoid muscle. This forms the muscular triangle. So this forms the muscular triangle. So this is the submandibular triangle. This is submental triangle, and so posterior triangles are subdivided into occipital triangle, which is bounded anteriorly by the sternocleidomastoid muscle, and inferiorly by the posterior belly or the inferior belly of the omohyoid muscle, and posteriorly in the midline by the median one. And so another is the subclavian triangle. So subclavian triangle is a small triangle, so it is bounded anteriorly by the clavicular head of the sternocleidomastoid, and superiorly by the posterior belly of omohyoid. So these form the different triangles present in the neck, and we'll be later discussing about what structures are present in each triangle and which level lymph nodes do we have to dissect in these triangles. Thank you.